Hi, Allie. How you doing?
Good morning. I'm well. How are you?
I'm well too, thanks. People are not people. Democrats keep saying, well, they're people, but they're Democrats, so there's a different class of people. They keep saying they want to cancel Obamacare, but they don't have a plan. That is just a stinking lie. There is a plan.
There is. The president last week released his healthcare plan, which basically is a very neat and tidy way to bring together all of the various pieces that he's been working on since day one of this administration. But many of the pieces even actually go back to the first administration. And essentially what he's doing is asking Congress to take all of that and put it into statute so that administrations in the future can't undo it with an executive order or just choose not to enforce it like we saw with a handful of items this last go around in the Biden administration. One of the issues on that plan that we're most passionate about, of course, is healthcare price transparency, because it's impossible for families and for parents to plan healthcare but also preventative healthcare when we're doing so blindfolded.
And that is the problem. And don't get me wrong, we have very quality health care in our town. We really do. We have two great hospital facilities. We have clinics. We have satellite clinics. We have all sorts of stuff. But what I want people to know is that health care should not be this expensive. I get that you go to college and you go to med school and you do this and you become a doctor because you want to help people and make really good money, but gosh, when we can't afford insurance and we can't afford the health care, what good is it?
Oh, totally. And healthcare costs are a huge problem for many American families across the country. Yeah. Employer-sponsored family plans, the premiums have gone up more than 50% than a decade ago. You may recognize that kind of coincides with our dear Obamacare, which Republicans at the time screamed from the rooftops, hey, this is what's going to happen, and now that's coming to fruition. And of course, our friends on the other side of the aisle are saying, how are we going to fix it when we could have just never broken it as bad as it is, but story for another day. So with healthcare price transparency, of course, there need to be things done, which are other aspects of the president's plan to touch on affordability. But the biggest thing with price transparency is people need to understand what things cost. And even within the same hospital system, prices can vary from 10%, even just within the same hospital system. So what this would do is ensure that insurers are posting, if they receive Medicare and Medicaid coverage, are posting their pricing and their plans on their websites in advance, so people can act in plain language. There's a line in there about how it must be in plain language, so that people can actually look at A compared to B. What am I getting for my money? Especially if it's going to be expensive, you need and want to know what you're spending your money on, what provider it's going to, what percentage of it is going toward the actual treatment versus overhead, and all of those things are going to be posted so that families can have that negotiating power and those conversations with physicians and providers, instead of on the back end just being met with a bill that you have to, come up with the money for, or a payment plan, or in many cases, unfortunate cases, personal bankruptcy.
Or just not get the care at all. And
yeah.
I've seen that. I mean, that's a pickle right there, where you look at the prices, even if they are transparent, if they don't come down, people look at the price and they say, you know what, I'm not going to put this burden on my family. So whatever I'm sick with, I guess is just what God has in store for me. Let's let it roll, because they're afraid of burdening their families.
100%. And that can even, as you well know, that can make things worse, because then instead of, chipping away at and improving your health and managing your health and your symptoms over time, then you end up in the emergency room. And that's just, the worst, because you're in need of immediate acute care and you're not advocating for yourself and asking all those due diligence questions, because you just need and want to be better in that moment. And that is always more expensive than managing your health and your symptoms in advance of a crisis. And that's one of the greatest drivers of really high healthcare costs is this reliance on the emergent systems instead of, week by week, day by day. And if you have a family, if it's you, a spouse, and 2+ kids, I mean, if you're stuck in a position where you have to wait for emergent care for everyone, if you get stuck, that adds up so fast. And we really want to make sure that parents don't get hit with that.
Yeah. And American Parents Coalition is not the only group who is advocating for this. So there are so many different groups who sent me this same release. I decided to go with you because you have a cool name. So I look at this. I mean, Save Our States, patient right advocates, state financial officers foundation, everybody is down for this except the Democrats. So what we've got to do is just tell them to go over there for a minute and let us just fix this. The health savings accounts are a great idea, non-taxed ways to save for what might be, because we have St. Jude in our backyard, thank God. So if a baby gets cancer, we know exactly where we're going. But they don't do that for adults. And if you fall on the ice this weekend when we have this terrible storm and you crack your head open and you need surgery, you're just kind of SOL. You're going to have to pay whatever they're going to charge you, and you'll find out later what that is. You should be able to have a menu of what it's going to be.
For sure. And one more thing on how just the transparency aspect of it can improve the affordability. If a patient is empowered to look at what provider A can give them compared to provider B, those two providers automatically become competition to one another, and they have to lower their prices. It puts that back out into the free market for patients and for doctors to be able to compete and talk to each other and get those prices down to a reasonable state. And that doesn't include, of course, advancements in technology and all of these other things that help lower healthcare costs. This is just with the simple fact of making it transparent enough so that the free market can do its part and let people shop around and A versus B versus C to be able to get the best bang for your buck and make sure that you understand the quality of the treatment that you're getting from your provider.
Right. We're not talking about Medicaid and Medicare. That's not even what we're talking about. That's a whole different conversation.
Yep.
This is for people with regular health insurance or whatever. The answer for me has been concierge. I do concierge because I know how much it's going to be. I know how I can go anytime I want. I don't have to worry about it at all. But if something really, really bad happens, we're screwed. That's just the bottom line. There is no way we're going to be able to afford that $1 million bill if somebody has a heart attack or something. There's just no way.
Yeah, you end up in the emergency room, and you don't know what you're going to get as far as the bill's concerned.
Yeah, and you may live, but you're going to have a big bill to pay. All right, where do people learn more about this? The Transparency Price Act, it works with hotels on websites. They have price wars on airplane tickets. This works in every industry. It can work in the health industry, too. So
absolutely,
the people who are telling me it'll never work, yes, it will. So there's that.
We have more information on our website, AmericanParentsCoalition.org, and we also have a number of resources if people want to get involved and take the first step in either asking their senator or representative to support these measures or ways that people can add their comment to the rulemaking process over at HHS and a couple other resources on our site as well.
Yeah, and the cool thing is, since it came out of President Trump's mouth that he wants this, it's pretty much non-negotiable. So you can just go with that.
Yeah, and he's taken some action on it from the executive perspective, and what he's looking for now is for Congress to put that into statute so that in future administrations they can't choose to just not enforce it like what we saw with that Biden administration in between his two. So hopefully Congress can do that.
And we are out of time, but I can't shut up about this because it drives me crazy. Think of how many more small businesses or mid-sized businesses could afford to offer health insurance if it weren't so sky high. This affects everyone at every level. Rich, poor, small business, big business, single employer, whatever it is, it affects everyone, so it needs to happen. Alleigh Marre is the executive director with American Parents Coalition. Trump's health plan is forcing real price transparency. We just got to make it happen. Thank you, Alleigh.
Thank you. Have a good one.
You too. Bye.